Bismillahirrahmanirrahim. Assalamu alaikum, respected audience. Today, my topic of discussion is about a case of conjunctival squamous papilloma, its diagnosis by non-invasive methodology, and its management. This is a slide at the anterior segment photograph of the patient. Here you can see that the corneal vascularization is from almost 3 o'clock to 9 o'clock, and the superficial vessels are crossing the limbus, and there is fibrovascular changes, so with mild cataract changes. This is the anterior segment photograph of the same patient taken from infratemporal side. Here again you can see those vessels, how they are encroaching and progressing into the cornea and involving you can say it's going up to the mid-level, not visual access is yet spared, it's not involved that much. This is another anterior segment photograph of the patient which was taken recently. This patient has undergone cataract surgery, so it's now pseudophakic, and you can see the vascularization is all around, but at 9 o'clock you will see some regression of the vessels. This is because of the treatment we have given this, which will I discuss later on during my presentation. So we decided to find out what was the cause, what was the nature of this lesion by using non-invasive methods like OCT anterior segment. This is the anterior segment photograph by using OCT. Here you can see some involvement in the perilimbal, but not very clearly shown as in the photography. I will show you the detail and the significance of OCT in the next slides. Yes, this is the OCT anterior segment. Here you can see the elevated lesion. The lesion which is elevated conjunctival papilloma, and it is infratemporally focused over there, and you can see small, apart from that elevation you are seeing, there's small vascular cores over there. The thing about this OCT anterior segment is that the conjunctival epithelium, you can see here, that is continuous over there in the cornea, and there is no abrupt change if you see in the anterior-most layer of the epithelium in OCT. Secondly, the lesion is not involving deep into the cornea or into the anterior structures. You can see the angle, it is wide open, corneal stroma that is not disturbed, and there are some subepithelial fibrotic changes, but the corneal epithelium is not disturbed yet. This is again the same, which is magnified as I told you. Here again you can see the elevated lesion of conjunctival papilloma with small vascular cores superiorly, which are shown over there, and the same continuity. Basically it is the same magnified portion of the OCT anterior segment. So basically the OCT is showing us the thick hyperreflective epithelium, and there is no abrupt transition, and there are some vascular cores. What happens if there is a malignant lesion, for example ocular surface squamous neoplasia? The epithelium abruptly comes to a transition change over there, and it also shows some penetration into the deep structures. So this, although we do not have that much literature yet on the use of this non-invasive methodology, but it is still very effective in the management of OSN and the other benign lesions. So this patient was a middle-aged patient, male, who presented with the visual acuity of 20/20/20/30 with the best correction, and we decided to diagnose this one. So we went for incisional biopsy, that was taken, and to rule out any squamous cell neoplasia. The report came, it showed that it is a squamous papilloma with atypia, and our ocular oncologist was also consulted about this. And the same things which I mentioned earlier, subepithelial fibrosis, intact epithelium, no deep penetration, all these factors, and above all, the gold standard, incisional biopsy, made it clear that this is not squamous cell carcinoma. This is basically a benign lesion affecting between the ages of 21 to 45 years male, and basically it is called by human papilloma virus. It's a DNA virus, and this virus has been detected in 58 to 92% patients of squamous papilloma. And the most common virus out of all these is human papilloma virus 6 and 11. In spite of full treatments, it has a high recurrence rate, that is 3 to 27%. But this virus even is causing cervical cancers, uterine cancers, female genitalia cancers. So the vaccine which has been used and approved by FDA for the cervical carcinomas can have future benefits in human papilloma virus affected patients, but still it needs a lot of research, and it is not yet approved for use in the eyes. But it is a potential way that maybe after research we can find its utility in ophthalmology also. So the treatment of such lesions is that's straightforward surgical excision, and along with it cryotherapy can be done along the margins, and or can be used topical mitomycin. By using topical mitomycin eye drops, the recurrence rate has dropped to almost documented 7% in these patients. So as I told you earlier, we managed this patient with topical mitomycin eye drops. 3 cycles were done, 1 week on, 1 week off, and along with it topical steroids were also used to control inflammation. But if we talk about the treatment, the topical steroids have no role in controlling this lesion, but that was used just to control the inflammation. And this patient has already gone cataract surgery, and we are regularly following this. So as I mentioned earlier, that we usually use UBM and OCT anterior segment. UBM is good for malignant tumors. It shows us the posterior extensions, deep penetration, and it is good for that one, ocular surface squamous neoplasias. But it needs skilled hands, and the OCT anterior segment is relatively non-invasive method, very good for the benign lesions. It tells you about how different layers are there, and where the epithelium is changing, and but it has certain limitations that if there is optically shadowing, the fibrosis over there extensive, it cannot very clearly show us the posterior margins of the lesion. So it can be done by any ophthalmology technician, but it is good for the non-invasives. So we basically use our all modalities, as I told you earlier, OCT, UBM, and even the gold standard, that is a surgical incisional biopsy. So these are a few articles I have gone through, I have studied them, and I found it very beneficial. So I will also recommend my respected audience, if they're interested, to study further about squamous cell papillomas, their management, diagnosis, and even ocular tumor. These are very beneficial articles. I want to thank my respected audience also for their attendance and attention. Thank you.